everyone. Thank you for joining us today for the second Model Aquatic Health Code Network webinar entitled Considering MAHC Adoption First Steps. My name is Kelsey Edge and I'm a program analyst at NACCHO that has been helping to support this effort. I'll be kicking us off today and we'll be moderating our Q&A portion after our featured presentation today. Before we begin, there's just a couple of announcements. Please mute your computer speakers to prevent any technological feedback. Also, if you have not done so already, please call into the webinar conference line for the audio portion rather than using your computer speakers. You can do this by dialing 866-740-1260 and entering the passcode 463-8096 when prompted. Additionally, due to the high number of attendees on this webinar, please submit all comments and questions via the chat box on the right side of your screen. All right, again, welcome and thank you for joining. Today you'll be provided with some updates from NACCHO, CDC, and CMAHC before our featured speaker, Jim Rada of Jefferson County, Colorado. So if you have not done so already, please be sure to check out the new MAHC Network webpage on NACCHO's website. This will be the home for all MAHC Network webinar PowerPoints and recordings, MAHC resources, and announcements. And it'll also serve as a home base for Colorado's resources that they've been using, which Jim will touch on a little bit more later. Also, if you're attending NEHA this year and you're interested in hearing more about the MAHC, NACCHO, CDC, and CMAHC will be speaking during this session. We also have a couple locals as well. It'll be a speed mentoring session, so it'll be an open discussion, and it will be held on Tuesday, June 14th from 3:30 to 4:50, so we hope to see you there. All right, additionally, our next MAHC Network webinar is tentatively scheduled for July 12th at 1 p.m. It is entitled MAHC 2.0. Where we'll have speakers discussing the new version of the MAHC and some changes and edits that have been made. Also, as a reminder, to receive more information about the network or to be included on the listserv, please send your name, title, and affiliation to mahcnet@naccho.org. Thank you, and I will now turn it over to Jason Kuntz of CDC.
Hi, this is Jason here. I co-lead the Model Aquatic effort here at CDC with my colleague Dr. Michael Beach, who couldn't be here today. He is assisting with the Zika response. You'll be hearing from Dr. Beach in the future. I wanted to provide just a brief update on the second edition of the Model Aquatic Health Code. At this time, the MAHC is in clearance at CDC, and we anticipate releasing the MAHC in June at this current time. It will be accompanied by a partner and communication outreach effort as we did in the first edition of the MAHC. And during the next webinar, I will be covering the top 10 things you need to know about the MAHC second edition, and we'll be holding a question and answer session. And additionally, my colleague Michelle Halavasa, who will be providing an update in a moment, will also be speaking at that webinar, and I'll let her tell you about the topic. Thank you.
Thank you, Jason. This is Michelle, and during that session we'll be talking about our findings looking at aquatic inspection data from 2013 from 16 jurisdictions in 5 states.
And Michelle, feel free to provide, and Michelle at this point in time will provide an update on the Healthy and Safe Swimming Week effort that is currently undertaken at CDC.
Great, thank you, Jason. So what we're doing for Healthy and Safe Swimming Week, which is the week before Memorial Day, so this year that means May 23rd to the 29th, we are pushing for improved aquatic venue operation and maintenance. We are encouraging swimmers to check inspection reports for public aquatic venues and to do their own inspection. You know, we're encouraging swimmers and parents of young swimmers to look at the disinfectant, or more specifically the chlorine level, the pH, to look to see if the water is clear, and they can see the main drain at the bottom of the pool, to make sure that main drain is secured and in good repair, and also to see if there's a lifeguard, and if not, if there's safety equipment available to rescue any distressed swimmers. As every year, our target audience is swimmers, parents of young swimmers, aquatics, and public health. Earlier in the year, about a month or so ago, we released the Healthy and Safe Swimming Communications Toolkit. The toolkit includes community outreach suggestions, reaching out, for example, to local chapters of the American Academy of Pediatrics, reaching out to the media, reaching out to apartment complex HOA groups. We also included a list of resources or links. Basically what we've done is we've updated the Healthy Swimming website to make it to put it into responsive design, which means that you can not only see it on your desktop or laptop, but you can use your iPhone to look at web content on the Healthy Swimming website. We also put out in the toolkit a sample press release, a sample op-ed piece, and a sample proclamation. As I mentioned earlier, our big push this year for Healthy and Safe Swimming Week was to look at inspection data. Every year we put out an MMWR for Healthy and Safe Swimming Week. This year we looked at aquatic inspection data from 16 local jurisdictions in 5 states. The focus of the report was looking at the percentage of routine inspections that resulted in immediate closure of a venue due to serious violations that threatened public health, the percentage of inspections that found at least one health or safety violation, and the percent of inspections that found specific health or safety violations, whether it be overall or by venue type, meaning pool versus hot tub spa, or pool category, which could include kiddie wading pool or a water playground or interactive water play venue. We focused on 15 items within the MAC that we thought were most important or most critical to protecting public health and safety. So that meant our analyses focused on safety equipment, disinfectant concentration, pH, and securing pool chemicals, for example. To help get the message out about the importance of pool inspections and doing your own inspection and checking out an inspection score before you get into the water, we, again, are improving our Healthy website. Next Monday, we are hosting with NBC News Health a Twitter chat. It's at 12 noon Eastern Time, and for an hour, we'll just be tweeting about healthy and safe swimming. Additionally, we are doing social media outreach through CDC's Facebook page, and we will be on CDC's main homepage for the week, promoting healthy and safe swimming. Other efforts we're trying to make to reach out and disseminate healthy and safe swimming messages, there will be a Gov delivery announcement about the week and resources available for the week. We're also doing a Did You Know email that goes out throughout CDC and to our state and local partners to kind of summarize the MMWR findings coming out. We are also putting out an email, Have You Heard?, which is an opportunity for our state and local partners to highlight what they do in terms of protecting public health. And our partners at the Florida Department of Health are going to be highlighting their aquatic inspection program. We've also on the Healthy Swimming website put Healthy and Safe Swimming Week buttons and badges, which you all can download and put on your own sites. We've put out a new infographic. The point of the infographic is a checklist, kind of summarizing how the public can do its own inspection. We also have what we call syndicated web content, and that represents an opportunity for our state and local partners to take CDC's Healthy Swimming website content and make it look like their own. So the web content is developed here, but then when you use the syndicated content and incorporate it into your own website, for example, when we update our content, it automatically updates, but it looks as if it is the local or state health department's content. The link on this slide shows you where you can go to get at the syndicated content. We also have a lot of healthy safe swimming promotion materials. We have a brochure. We printed out 1 million copies last year. Most of them are in English, but there's some available in Spanish. Those are for free, and you're free to order them. If your order goes above the limits, no worries. We can approve that, and you can order more to help get the healthy and safe swimming messages out. We also have posters that are available, the steps of healthy swimming, what's in your cannonball, which kind of explains to swimmers what they're potentially bringing into the water if they're not swimming, or if they're not showering before they get into the water. And there's another poster called Make a Healthy Splash, talking about how to be healthy and safe in our water playgrounds or our interactive water play venues. These, unfortunately, they are downloadable, but we haven't printed them and they aren't available as the brochures are. We do, however, have pool chemical safety posters for aquatics professionals. There are two posters. One specifically addresses storage, the other one use. Both are in English and Spanish, and they're laminated so they can survive that caustic environment in chemical pump rooms. So those are available for free as well. And again, if you go over the ordering limit, no problem. We can approve it and get it out to you. The American Chemistry Council, through the Water Quality and Health Council, is providing pool and hot tub test strips. And that's on their Healthy Pools website. All of this, all these materials and all these freebies are available at the URL listed at the bottom of the slide, cdc.gov/healthy water, swimming, and resources. And if you have any questions about health communications in terms of healthy swimming, you can email healthywater@cdc.gov. And for all your healthy and safe swimming needs, you can go to the Healthy Swimming website. Thank you. Thank you, Michelle. All right, next up we have Doug Sackett. Take it away, Doug.
Hello. Welcome, everybody, for this session. There's one item. Can everybody hear me okay? Kelsey, can you hear?
Loud and clear, Doug. This is Jason.
Okay, thanks. So I'm Executive Director of the Council for Model Aquatic Health Code, and one item that I wanted to update for you on the CMAC is a search function that we have for the MAC that's accessible on our website. And Kelsey, you're going to help me kind of walk through this, right?
Yep, whenever you're ready.
Okay, I'm ready. So we've got a search tool. So if you go to the CMAC website, and I'll wait for Kelsey's screen to come up here. And I think this search tool will be helpful for those if you haven't seen it or used it yet, particularly those that may be looking at code comparisons from your local code to the MAC, or those using looking to find out what's in the MAC and search some items. This search tool is pretty handy. So here's the home page of the website. So if you go to View the MAC on the left-hand side, click on that, and a drop-down you'll see Search the MAC. So if you click on that, and that brings up the search area. So the first thing you'll need to do up in MAC version is select the MAC version. There's a drop-down there. For now, it's the first edition, which Kelsey's going to click on that. As Jason had mentioned, the second edition will be out sometime in June. As soon as we can, that will be uploaded. Each version is going to be maintained, so you can search the different ones on there. But there's two different ways to search this. One, you can enter the search term in this box, which you can either enter a phrase, a word, a term, or a code section. Right now, let's do CYA for cyanuric acid. Just CYA and click Search the MAC on that. And what it does, it'll bring up any and all sections where it's looking at, where the CYA shows up. And you'll notice where there's annex available, yes or no. So the third one down, it says there's annex available. So Kelsey can click on that cyanuric acid line there. And what it'll do is pop up, once she clicks on that, scroll up to the top there of the screen. Kelsey, if you, okay, scroll up to the top of the page because there's an extensive, so the top will be the actual MAC code section, and if there's any annex of information available, that shows also in that pop-up screen. So, and if there's any, so anyway, close out of that one, Kelsey, if you would. You have to scroll all the way down the bottom and close that box. You'll see as you're scrolling down that there's a MAC sections in red that's referenced. You do have the ability to click on that, and that'll bring you to that reference section. We've also put a print button, so if you wanted to print that particular section, you can click that, and just the section will pop up. There's another way to search the MAC and view the table of contents up at the top right there. If you click on that, it'll bring up the table of contents. I'll wait for that to catch up. And you'll see that you can click on any of those and view it. You'll notice that there's some with an asterisk, like 4.1.1 down below here. There's sections with asterisks on there. If you close that out, so hit the close button there. But just scroll down so you can see the 411, and click over on the left on the number there, on the 411 where there's an asterisk, just as an example. Okay, you'll see it in red. So the subsections show up there. And then you can click on the view to bring up any of the sections. So that's just, it's pretty self-explanatory, but I just wanted to show folks what's there. There is, if you close out of that section, Kelsey, scroll down to the bottom and close that out. Okay, you'll see that the whole MAC glossary is there, view the MAC acronyms, and search instructions are all there. So it's, I think it's a helpful tool, and as you use it, if you have any other suggestions or comments, please send them to us. Where it's a member benefit, or trying to be a benefit or value to membership. So if if you needed to do something else or additional items, send us a note, and we'll see if we can incorporate that. So that. Again, it's just the brief overview of the search function there. So, Kelsey, if you go back to the PowerPoint, and I'm not going to belabor this, but the rest of my presentation is just, here's the next slide shows the, for additional information on websites, you can see the CDC's MAC site or the CMAC website. And then the next slides, again, we're always appealing to folks, particularly public health folks, to become members. So, next slide, you'll see on the website, again, become a member. If you click on that, and the next slide will bring up that page, and you can click on that secure form and enter your membership information. And again, we're appealing to folks to become members if you are not already. This allows you to participate and, most importantly, to vote on any potential code changes and participate in committees, et cetera. So that concludes the updates that I had from CMAC at this point, and thanks for your time.
Thank you, Doug. We will now hand it over to Jim, who is our featured presenter for today. Go ahead, Jim.
Can you hear me?
You sound great.
All right. Thank you so much. Thank you to NACCHO and CDC and CMAC for the opportunity and especially the invitation to share what's happening in Colorado and around the possible adoption of the Model Aquatic Health Code. My name is Jim Rada, and I'm the Environmental Health Services Director for Jefferson County Public Health in suburban Denver. And I also have been involved with the Colorado Directors of Environmental Health Organization here for almost 3 decades. And so that's an organization of local primarily local environmental health directors from across the state. In 35 years of working in public health at the local level, I've spent probably no more than about 6 months total time working in the arena of aquatic venue regulation. So you're probably thinking, well, why are you talking to us about adoption of the MAC? Well, although I'm not an expert in the field per se, I have spent many, many years working in the policy arena and have been involved in many major statutory and regulatory revision processes, most of which have involved stakeholder process or coalition building activities. And so many of my colleagues who are deeply involved in this field, and I believe that it's time for Colorado to take on such a process and get going on revising our laws and regulations around aquatic venues. So today, when I was first approached by NACCHO to present on our efforts towards regulation revision here in Colorado, I was a bit surprised and confused because we really hadn't gotten too far at that point. Well, in the grand scheme of things, we still haven't gotten too far, but we're making some progress. And so today, I'd like to talk to you a little bit about and give you some information about the current state of Colorado's regulatory program, and then share how we have gone about deciding to look at revising our laws and regulations for aquatic venues, including what we've done so far with initiating the process. And then finally, I'll share a bit about the current plans for advancing initiatives to see that statute and regulation change becomes reality. So Title 25 of the Colorado Revised Statutes is where most of the public health specific laws in Colorado are located. Part 8, Article 5 of Title 25, in a couple of pages, lays out the laws related to swimming areas, in quotes there, which is, as defined, includes natural swimming areas and swimming pools. Section 808 of Article 5 allows local agencies to adopt an ordinance that allows them to regulate swimming areas, and local regulations may be more stringent than the state regulations, but local ordinances cannot supersede state law. Section 810 requires the Colorado Department of Public Health and Environment to adopt minimum rules and regulations for school swimming areas. And the last version of those regulations was approved by the Colorado State Board of Health nearly 20 years ago. Additionally, there's a provision in the Colorado Public Health Act that allows local health departments to provide environmental health services and to assess fees to cover the cost of those services. The oversight of Colorado's swimming pool and mineral bath regulations falls under the purview of the Water Quality Control Division at the Colorado Department of Public Health and Environment. Rulemaking authority over these regulations lies with the Colorado State Board of Health. There has never been a great deal of resources at the state level put towards oversight of this program, and as such, the Colorado Department of Public Health has very little ability to oversee or administer the rules and has very limited ability to provide technical assistance to local agencies. So for many years, CDPHE, or the State Health Department, has supported the idea of this program being administered at the local level, allowing local agencies to opt into the program as they see fit for their communities. Earlier this year, the Colorado Directors of Environmental Health conducted a statewide survey of local environmental health programs to gain an understanding of their involvement in the regulation of aquatic venues. 41 of 64 counties participated in this survey. The survey data indicated that there are likely around 1,800 to 2,000 public and semi-public pools across the state. These different types of pools, along with private pools, are specifically defined in the current regulations, with private pools being exempted from regulation. 17 counties indicated that they operate a full inspection program, although inspection frequency varies by agency. And these inspection programs are generally a very small part of the agency's overall workload, usually requiring a fraction of an FTE to administer. The City of Denver has 3 full-time employees to regulate an inventory of 780 facilities, and this is by far the largest program in the state. 11 counties on the survey indicated that they currently only respond to complaints related to pools and mineral baths. And also licensing is rare, although most agencies with active inspection programs do assess fees for inspection services. So we started to put our toes in the water, so to speak, around looking at regulation and statute change a number of years ago. And it's been, as I alluded to earlier, for a number of years, it's been widely accepted across the state amongst both government officials that the Colorado laws and regulations relating to aquatic venues are sorely out of date. Initial discussions to pursue updates began in late 2012 with a small work group formed out of the Colorado Directors of Environmental Health that met through 2013, which coincided with the development of the first edition of the Model Aquatic Health Code. Ultimately, the work of this group resulted in draft statutory language from the Attorney General's office here in Colorado. That was in January of 2014. Unfortunately, that effort stalled primarily because of several other initiatives that in the local health department world were much bigger and relatively more important matters. These included statutory and regulatory rewrites of the on-site wastewater treatment system statutes and regulations, also retail food statutes and regulations, child care center and school regulations. So we've been quite busy kind of reforming our public health, local public health programs in the state, and aquatic venues kind of had to take a back seat. Additionally, we only had anecdotal information or limited anecdotal information as to whether the aquatics industry was really in favor of a major regulation change here in Colorado. So last July, this topic was again raised at the quarterly meeting of the Colorado Directors of Environmental Health, and at that meeting, state health department representatives informed the local environmental health directors that they didn't have the resources available to initiate or sustain a statutory or a regulatory revision process. So I happened to be the president of that organization last year, and when we heard that information in July, as we were planning our October meeting, we reached out to Jason Coons from CDC and Susan Wickman from the National Swimming Pool Foundation here in Colorado Springs, and invited them to attend the directors meeting in October to discuss the newly adopted MAC and the possible adoption or adaptation to meet Colorado's needs. And at the end of that session, the directors of environmental health agreed that it was time to proceed, and I agreed to initiate a process to explore if there was adequate support statewide to proceed, and also to gain a better understanding of the readiness in our state. So from January through April, I assembled a small work group to try to find out how to move forward, and that group, which consisted of 5 state and local government officials, 2 technical level staff, and 3 policy level staff, as well as Susan from the National Swimming Pool Foundation, and we also added eventually a representative of the industry to our group. And we've held 4 or 5 meetings in preparation, and we also have connected with the NACCHO MAC network, and they've been providing us much needed support, as this initiative has no funding base, no other financial support available. And so the first focus of this group was really to gain interest in moving an initiative forward and to gather data to help us understand perspectives as to the readiness of stakeholders to move forward. And we really wanted to identify possible leaders that could really help us push these initiatives, and also to build a broad-based coalition so that as we move forward, this work can really be viewed as a broad-based effort, and one in which industry is supportive. So the first plan of the group was to have a general interest webinar just to tell potential stakeholders about what we were thinking. And so we were so fortunate to have the National Swimming Pool Foundation right here in Colorado, and we were able to tap into their email list for distribution of a series of announcements for this event. And we also distributed the announcements to our environmental health directors mailing list. So all in all, well over 5,000 people were contacted about the general interest webinar. So here's the title slide from our May 3rd webinar, and as we kicked off the session, I stressed that the intent of this webinar was only to determine the interest level and perhaps readiness of the aquatics industry to join forces with the regulatory sector to put more current and sensible laws and rules in place that would elevate best practices for both the industry and government into the 21st century. And I also emphasize that from the start, there was no specific, or there had been no specific decisions made as to if or how an initiative would proceed. So this webinar was really solely intended to start the conversation, provide information and maybe some initial ideas that we've been tossing around, and begin to gauge the interest level of all stakeholders in moving an initiative forward. So here's the agenda for the webinar. All we really wanted to do was to give an overview of the current regulatory program, offer a public health agency perspective and an industry perspective regarding the value of, or a case for, revising the Colorado laws and regulations. And we also wanted to get a sense of how familiar the listeners were with the MAC, and to do somewhat of a comparison between the MAC and our current state regulations. Finally, we saved a little time to kind of give our thoughts on possible next steps, and then to answer a few questions as we could. Thanks to NACCHO, we were also able to incorporate online polling into the webinar, and we chose for this interest webinar to ask 3 specific questions. So during the session, we pop up a question and have folks vote on it. First, we wanted to know what sectors our listeners represented, and as you can see, over half of the participants that responded were from local or state government, but 45% participation by other sectors of the industry is really pretty good for this type of a meeting. So we felt very good about the level of participation and the broad-based nature of that participation. Polling question 2 was really around, or aimed at, helping us understand familiarity with the MAC. And it was great to see that over 80% of those responding were somewhat to very familiar with the Model Aquatic Health Code. The final online polling question was aimed at giving us a sense of the readiness to proceed with a statutory or regulatory revision process. And it's apparent that there's ample readiness to move forward, and it seems that the not sure responses could change to yes if an acceptable process is established. So that gives us some good information to really pay attention to the process as we move forward. At the close of the webinar, we also promised the participants that we would be following the webinar with a bit more detailed SurveyMonkey to gather additional information and to gain a sense of who might be willing to take an active role in developing these initiatives, as well as gaining an understanding of issues and concerns that stakeholders might want to see addressed through the process. And on May 9th, we sent the survey out to all 5,000 plus email addresses with a rapid turnaround requested. And so I'll share some of the results that we had as of May 13th. And of the 41 on this slide, of the 41 respondents, even more were from industry sector than the local government, which helps us to really understand that the industry is, I think, very interested in seeing what we're going to do. Question 2 of the SurveyMonkey, again, over 80% expressed a readiness to advance an initiative. The others said either no or not sure. I think we could convince some of those folks, if we develop a good process, to come along with us. This is kind of a hard to read slide, but I wanted to just share it anyway. This is you can look at this later on when this is posted, but this is the kind of responses we got regarding which section of the current Colorado regulations that participants wanted to see removed or appropriately changed. And I believe many of these issues are addressed pretty thoroughly in the MAC. So I think that's another good gives me a good sense that we need to look closely at the MAC as we decide to move forward on regulation change. Question 4, are you interested in volunteering with working groups? And those that answered here, roughly 63 might be willing to participate in groups, and some of those, I think, again, when they learn more about what we're doing, I think we'll be able to convince some folks to come on board. Question 5, we were able to get some commitment from folks, which was great, to join us and help us work on this. It's encouraging to know that there are others out there that are interested in contributing to our efforts. Question 6, how familiar are you again with the MAC? Looks like vast majority are somewhat familiar with the Model Aquatic Health Code. Question 7, what is your impression of the MAC? Looks like there seems to be some apprehension or uncertainty about its appropriateness for meeting Colorado's needs, but again, I think it's a matter of, gives us a sense that perhaps there's some training or some sort of educational or outreach activity needed to make people more familiar with the MAC before or as we move ahead. Question 8, again, kind of a wordy slide, but here we were looking to gain more insights into what sections of the MAC people would like to see added to the regulations in Colorado. With these 11 responses that we received, it appears that some people are unsure, but it looks like stronger design, operations, and maintenance regulations are desired. I don't expect you to read this entire paragraph, but any comments you would like to share about the webinar, most of the responses were complimentary of the webinar, but I wanted to highlight this particular response because it offered some cautionary statements about adopting the MAC by reference, such as including aquatic venues currently defined as private into the regulatory scheme of the state program, and taking consideration during implementation to allow time for training so that regulated entities wouldn't be overwhelmed or find themselves in difficult compliance situations. So next steps, which I call baby steps here, and this is a reference to my 4 grandchildren. We promised the webinar's participants that the SurveyMonkey would follow on the heels, and as you've seen, we held true to our promise. Following the survey, it appears that there's a sense that industry and government want to move forward, so we will soon invite interested parties to come together to work on developing and implementing an effective stakeholder process. As part of the initial steps, we'll also have to develop a strong communication plan so that all stakeholders, including elected officials at the state and local level, are kept clearly informed as we progress. That said, we'll have to start pretty soon. So as we move forward, we'll explore whether this program should be modeled after other similarly structured public environmental health programs, such as our body art or on-site wastewater programs, or whether it should be delegated to local agencies like the on-site wastewater program here in Colorado. Each approach has its pros and cons, so we'll be having to study that a bit. If statute changes are deemed necessary, and I think that there's a pretty strong case for that, we'll need to develop a legislative working group pretty quickly here, because the legislative process in Colorado really takes from the end of this year's session, which was last week, until the beginning of the next session, which begins in January. So we'll need to utilize that time between now and January effectively in order to get our political ducks in a row, so to speak. So if we are successful, we'll introduce legislation during the session and have all of the necessary statute changes in place by May next year when the session ends. That's a big step. That will be a big step for us. So Some of the big questions around MAC really rest on whether we would adopt the MAC outright by reference or adapt it to Colorado's specific needs. As we saw in some of our webinar comments, there are also a number of suggested adaptations that would potentially stretch local agencies beyond the current regulation and perhaps their current capacity to carry out a program. So all in all, these should be very interesting discussions, and right now I believe that this regulatory revision will take until early 2018 at least in order to get it all the way through the process. So that's the end of my presentation, but I wanted to take a moment to thank Ms. Kelsey Edge at NACCHO for the technical support she's given us, both here today and in our earlier webinar. And I also want to publicly thank the members of the Colorado Department Directors of Environmental Health MAC work group, that being Susan Wickman from the National Swimming Pool Foundation, Brian Hlavacek from Tri-County Health Department, Jeff Lawrence from the Colorado Department of Public Health and Environment, Adam Richardson with Colorado Pool Systems, Steve Chevalier with Tri-County Health Department, and my good buddy Craig Sanders down the hall from me right now from Jefferson County Public Health. All of their combined efforts have gotten us to this point, and I think we'll see some continued progress and hopeful success as we move along. So with that, I'm happy to take questions from the audience.
All right, thank you, Jim. Like you said, feel free to submit any questions or comments that you have into the chat box. It looks like we've already had some great conversations in the chat box, which is great. We want you guys to utilize that as much as possible and connect with each other and sort of figure things out. But no, we will wait for questions. All right, looks like we have a question from Ryan Mason. Was there a particular group that exhibited the most resistance to adopting the MAC?
We haven't gotten to a point of resistance. I think the emphasis of our work to this point has really been to kind of gauge the interest, understand where people are in terms of their understanding of the MAC. But to this point, we really haven't had any pushback. I think as we get more into the process of either adopting laws or that enable us to use the MAC, or getting into actually creating regulations, that's where we may, I think, more likely we'll see some more firm discussion, if anything, about what's appropriate in terms of the needs for the aquatic industry here in Colorado.
Okay, next we have a question from Nancy. She says, what do you think will be the response from hotels, motels, and campgrounds will be towards adopting the MAC?
So far we haven't heard specifically from them, but under the current Colorado regulatory scheme, hotels and motels and most campgrounds are considered semi-public pool, which fall within the regulatory scheme of Colorado. So they are, the current regulations do apply to them. So there's some discussion, or I've heard some discussion recently about whether we should include private pools, that being apartments, condominiums, and private or other types of venues like that. My assumption at this point would be we will continue to regulate semi-public pools, that being hotels and motels and things like that. There'll be some, I think, more heated discussion about whether we really want to dip into the private sector.
Okay, next from Paul Reeves. Do you attribute any of the resistance to making new regulations to simple staff shortages or budgets?
Well, it really, I think, Paul, it really depends on how we structure the program. If it's similar to what it is right now here in Colorado, where a local agency can opt in to having a regulatory program, budget and manpower will drive that. if an agency doesn't have enough people to do it, or the political will to do it, they won't. We're hoping that we can get the MAC adapted or adopted as a minimum state regulation, which then could be advanced by the locals in a local ordinance and perhaps even made more stringent in some regards at the local level.
Okay. Next we have a question from Terry, and I apologize if I butcher this. I'm by no means an expert or a biologist. Do the regulations address monitoring of pathogens such as Mycobacterium marinum? And I'm guessing this will be open to anybody.
That is not a question I can answer, so...
This is Jason Kuntz from CDC. Others, please chime in. Specifically in the MAC, we do not have testing requirements for pathogens outside of an outbreak situation. I'm really relying on the operation and maintenance of the swimming pool or the spa in that case.
Okay. Next up, we have a question from Mark. This is for you, Jim. How have you approached the lack of mineral bath or hot spring regulations in the MAC?
We have not. We haven't gotten that far yet, so I can't say that how that will be addressed. We do have significant numbers of mineral baths and hot springs here in Colorado, so I'm assuming that will become a topic that will need some attention as we move forward.
All right, looks like we've got a couple more people typing. Are there any regulations for pools with salt water?
I can handle that from the MAC perspective and let Jim also chime in from a Colorado perspective. Saltwater pools are covered in the MAC, so there's been that shift moving towards saltwater pools that many are aware of, but it's really another way to just generate the chlorine ion through these salt generating systems. So it is still considered a public chlorinated swimming pool. All MAC regulations would apply to that.
I believe that's the way it's handled in the Colorado regulations also.
And Jason, this is Michelle. Just to add, it's more about making sure you have enough cells to generate the chlorine and keep it where it needs to be, and somehow have a way of having a backup, having something that if you have a lot of swimmers come in at once, you can maintain that level, right?
Absolutely, yeah, that's critical. That was an oversight on my part. Yep, if you can't meet it with the current salt generation system, maybe a supplemental chlorination system is needed to account for changes in bather load.
All right, thank you all. Is anyone aware of model statutory language for adequate authorities?
I'm going to need further clarification on what adequate authority is, and feel free to type that and we'll come right back to your question.
All right, looks like we've got a couple people typing. We'll wait for some clarification and some more questions. Feel free to ask questions to anybody that was speaking and presenting today as well.
And I have one for Jim specifically that we'd like to ask the webinar presenters. This is Jason Kuntz from CDC. Are there any resources that you found helpful from either on the CDC or the Council for the Model Aquatic Health Code website for undertaking this effort? Or is there anything that you feel is missing that could improve at least someone taking these early steps for adoption?
You know, I haven't gone to those websites myself to look, and we really haven't had that level of discussion. We did include in our webinar, as I mentioned, a kind of a crosswalk between our local or our state regulation and the MAC to try to kind of demonstrate the similarities and perhaps some differences between the two. But again, we're very, very early in our process, and I'm sure that as we move forward, we'll be utilizing other resources to help us along the way.
Okay, thanks. I didn't mean to put you on the spot there, and that's the point of this network here too, is to let us know, let us be vocal, for network members about what resources you do need. And as Jim pointed out during his presentation, CDC and the CMAC and others are accessible. We can help you have conversations, if you come to us with specific questions around the MAC. We have some code comparison tools outlined on the MAC website, and with the release of this new search engine on the CMAC, we're trying to make it as easy as possible. And what Kelsey and I were discussing and others this week, the MAC Network website will continue to grow. We just released the new MAC Network fact sheet this week up on the resources section, and we will be archiving these webinars and adding additional resources as the MAC Network informs the effort.
And I believe just yesterday, Kelsey sent me an email that said that Colorado will have a tab on that resources site also. So all of our materials, meeting notes, information, any other resources we develop along the way, we will be posting on that resource site. So they will be free and accessible to anyone who's interested.
All right, thank you for that announcement. And it looks like Kimberly has been able to follow up on her question. She says, in Alaska, authority for regulation over pools and spas is vague at best. I'd like to amend the statutes to be clear that we are responsible for sanitation and safety in pools and spas, and would also like to get the legislature board on with the MAC. I would love to see model statutes that states can use and amend to ensure authority allows clear authority to regulate sanitation as well as safety, including life-saving equipment, ability to access bathers for emergencies, anti-vortex drains, etc.
Thank you, Kimberly. That's actually a really good question. At this point in time, we do not have any model statutory type language, but that doesn't mean that's not something that we can't consider. Immediately coming to my mind here is a resource called the National Conference of State Legislators, NCSL, who CDC and others have partnered with over the decades, and they have a specific MAC-related fact sheet from NCSL that can be used to inform conversations with policymakers. So if you can, Kelsey will share my contact information with you, and we can take this conversation offline and connect you with those resources.
And Kimberly, this is Jim Rada. I'm happy to send you also the draft of what we had drafted from our State Attorney General's office. I don't know if it'll answer everything that you've suggested or asked there, but certainly we'd be willing to share with you, and also would love to have discussion on that.
All right, thank you both. And thank you, Doug. It looks like he's been fielding some questions in the chat as we've been going along, so thank you for that. We have a question for Jim. Does Colorado monitor for mosquito larvae?
That is not a part of our current regulations, no.
Okay, thank you. We have another question from Daniel Bowman. He says, Pennsylvania's current turnover rate is 8 hours. I'm concerned that this will be almost impossible to get pools up to a 6-hour turnover rate without significant capital expenditure. Are there any suggestions?
Doug, do you want to field that question and weigh in?
Yeah, this is Doug. I sent a note on response, but typically like the design standards for the turnover rate, any of their design criteria typically only apply to new construction or substantially altered. It wouldn't, if you adopted the MAC and that was a design standard, it would not, it's not structured to retroactively apply and have to have a pool be reconstructed or redesigned to meet the present standards. There are some notable exceptions to that, but typically it wouldn't retroactively apply.
All right, thank you.
And real quick, Michelle, I just happened to catch that Paul Reeves was wondering if you could send him a copy of your PowerPoint presentation. He has a meeting right after this to discuss your topic. and I can connect you with Paul's, but I think you
No, I
have
have
his
Paul's
email.
address. Okay, got it.
Okay.
All right, thank you both. And then it looks like we also have some MAC work in Ontario, Canada, which is great to hear. They're using the MAC as a baseline for new regulations for pool spas and splash pads, etc.
And this is Jason. We are aware of that. We've had some contact with Ontario, and we are extremely excited that our neighbors to the north are considering the MAC for updating other pool codes. So keep us up to date on it.
It looks like we've got about 5 more minutes for some questions. And if you're able to log into the webinar today, I'll be able to send a follow-up email to everybody with everybody's contact information if you have any follow-up questions or comments, or if you'd like to connect with anybody that presented today. And I'll also be able to send out a recording of the webinar just in case you'd like to go back and listen. And this will also be housed on the NACCHO Model Aquatic Health Code Network webpage that we mentioned earlier. Is there any more discussion on float systems in the MAC?
Yeah, and I want to combine these two here because I think I can answer in the same way, and it's also any background on why mineral baths were not addressed. So at this point in time, Paul, the flotation system conversation is occurring at NSF, and as you know, we've mentioned in the past in some of our offline conversations that the Council for the Model Aquatic Health Code and CDC in our opinion here, thinks we need to have that conversation about potential regulatory language for a flotation tank provision in the Model Aquatic Health Code. Of course, there's some stuff that still needs to be worked out around the certification of these actual floating systems that would then be coupled with regulatory type language. And so yes, we continue to address that topic, and we would like to see that move forward. So I realize that was a bit of a wonky response, but so yes, there are ongoing discussions. And regarding the mineral baths, Doug, do you have a perspective on why the mineral baths were not included? I suspect that when we were creating the MAC, that it was focused on chlorinated venues or treated venues, and but we do recognize there are other types of recreation and water immersion that are not occurring in treated venues that states and others may be wrangling with.
And this, Doug, what exactly, I'm not exactly clear on what the mineral baths are, you know, what the definition or what functionally how they operate. Are they natural bodies of water? Because if they are, that's why the MAC does not address them, because it's only man-made, you know, structured type, not natural bodies of water.
Well, there are some, this is Jim Rada, in Colorado, there are a number of facilities that are fed with natural hot springs, but they are man-made structures, pools, and they're typically flow-through. I'm not sure about how they treat the waters, but are you saying that if there's a flow-through system from a natural hot spring or mineral spring that it would not be covered in the MAC?
Well, this, Doug, from the structure of the MAC, if we define, you know, what a pool is, then by definition, you know, it's a structure, I have to the definitions here, but then you would, then the criteria, the design standards and operational standards would apply. So the first thing we have to do is go, you know, into the definition and see, okay, does this facility or this meet the definition of what a pool is, and then go from there. I'm just trying to look. Pool, it says subset of aquatic venues. So we have to look at aquatic venues from a definition. It says where our starting point would be an aquatic venue means an artificially constructed structure or modified natural structure where the general public is exposed to water intended for recreational therapeutic purposes. Such structures do not necessarily contain standing water, so water exposure may occur via contact, ingestion or aerosolization. Examples include swim pools, wave pools, lazy rivers, surf pools, blah, blah. So by definition, it sounds like, and if they're either modified natural structure where the general public is exposed, it technically may meet the definition of an aquatic venue, and then the requirements for such would be would kick in.
Okay, it looks like we are out of time for the webinar today. Please be on the lookout for a copy of the presentation and the copy of the webinar recording via email. And I'll also include everybody's contact information in case you have any follow-up questions or comments. And also, if you have any feedback or any suggestions for future webinars, please feel free to reply to the email. We're always looking for new and fresh ideas. In any way that we can help you out, especially the same way that NACCHO has helped Colorado with their MAC adoption inquiries. So thank you very much, everybody, and we hope that you attend the next webinar. Thank you.
Thank you, Kelsey. Goodbye.
Goodbye.